An interesting fact that is unique to this medication compared to others is that it has the potential to cause a false positive amphetamine result on a urine drug screen. So definitely make sure to be mindful of this if you ever have to give a urine sample for whatever reason. Welcome back, Straight Talkers. Today I'm going to talk about the medication Wellbutrin so that you can be better informed when deciding whether or not to start this medication. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Each medication typically has a generic name and a brand name, and doctors will often use these names interchangeably. So for this medication, Bupropion is the generic name and Wellbutrin is the brand name. And the generic medication has the same chemical formula. So how does this medication work? Wellbutrin is considered to be a norepinephrine dopamine reuptake inhibitor, or NDRI for short. And it works by increasing the amounts of norepinephrine and dopamine in certain parts of the brain. So in adults, Wellbutrin is FDA approved for the treatment of major depressive disorder and seasonal affective disorder. Under the name Zyban, it's approved for the treatment of smoking cessation. This medication is not FDA approved for the use in kids. However, it is commonly used off-label. Other conditions that it can be used off-label to treat include things such as ADHD, sexual dysfunction, and bipolar depression. Some people will refer to Wellbutrin as a twofer medication, meaning that it can have a clear efficacy in treating two different conditions. So we commonly prescribe it in people who have both depression and ADHD, or even depression and tobacco use disorder, or depression and fatigue. It's often used to augment a primary medication with the hope of enhancing its efficacy. Common combinations include adding Wellbutrin to either an SSRI or an SNRI, and by doing so, it can also help reduce medication-induced sexual dysfunction or medication-induced apathy. Wellbutrin comes in tablet formulation. In addition, there's also an immediate release version, a sustained release version, and a very long-acting extended release version. The immediate release version must be taken 3 times per day. The sustained release version is taken twice per day, and the extended release version is taken once daily. And depending on which dosing version you're being prescribed, dosing is typically between 100 and 450 milligrams daily. And if I'm using this medication in kids, I'll often start at an even lower dose than what is recommended to help reduce the risk of potential side effects. And my approach is to always start low and go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. Once this medication started, it usually takes a couple weeks before you start noticing a difference, and in many people, it'll take a whole 1 to 2 months before it reaches its full effect at the prescribed dose. And because of this delay, I often recommend starting therapy during this time because the benefits of therapy can be seen right away. Now let's talk about potential side effects. It's important to realize that many side effects are often dose dependent, meaning that the likelihood of getting them increases as the dose increases. On the other hand, some side effects are also time dependent, meaning that they begin immediately upon starting the medication or whenever we make changes to the dose. But what we generally see is that these side effects will go away with time as your body gets adjusted to the medication. So Wellbutrin is often an appealing option for many patients with depression given its absence of sexual side effects and weight gain. It shouldn't be prescribed in those with eating disorders, alcohol use disorders, or brain conditions such as seizures, head injury, or brain tumors. Extra caution should be used when prescribing the medication to those with liver or kidney problems. The common, but usually more mild side effects of Wellbutrin can include things such as nervousness, constipation, weight loss, difficulty sleeping, dry mouth, headaches, dizziness, nausea, vomiting, excessive sweating, ringing in the ears, and tremors. More serious but less commonly seen side effects could include increased suicidal thoughts or actions in those under the age of 25 years old, manic episodes, seizures, liver damage, and increased blood pressure. And because of this potential to cause increased blood pressure, physicians will typically monitor your blood pressure regularly when on this medication. When deciding to come off of Wellbutrin, please do not stop taking this medication without talking to your doctor first. With that being said though, Wellbutrin carries a relatively lower risk when it comes to discontinuation symptoms and can usually be tapered over a week or so. Now head on over to the next one to find out more ways that you can help your child live their best life.